Sky Atcho. I am a nurse practitioner student from South University. I'm going to be doing a full head to toe assessment. Is that okay?
Yes.
Okay, let me just wash my hands. Alright, can you tell me your first and last name and date of birth?
Amanda Padres, 2393.
And then can you also tell me where you are today?
The doctor's office.
Good. So patient is alert and oriented ×3. Speech is clear. She is sitting upright, answering questions appropriately. Mental health is within normal. I'm going to go ahead and let you know what your vitals were. Your blood pressure was 116/68. Your heart rate was 72. Your temperature was 98.4 and your oxygen 98%. And then you weigh 149.
Okay.
Okay. So that's good. I'm going to go ahead and start with your skin. Okay. Skin is warm and dry. No lesions or abrasions present. No masses present. I'm going to go ahead and check your skin tone. Good. Capillary refill. Okay, capillary refill is less than a 3. All right, and then I'm going to go ahead and palpate your head, okay?
Okay.
Any pain or tenderness?
No.
Okay, so head is normal cephalic, atraumatic, no lesions or depressions noted, hair is well groomed, normal for ethnicity and race. And I'm going to go ahead and palpate your temporal arteries, okay?
Okay.
Can you open and close your mouth? Move it around. Good. Full range of motion on the TMJ. I'm going to have you puff your cheeks, smile. I'm going to have you raise your eyebrows like this. Perfect. And now I'm going to I'm going to have you close your eyes and tell me if you feel if it's sharp or dull. Okay?
Okay. Sharp. Dull. Sharp.
Good. Okay. And now I am going to go ahead and look at your ears. Okay. Any pain or tenderness when I do that?
No.
Any pain or tenderness?
No.
Okay. I'm going to go ahead and look inside. Okay. Okay, good. All right, so cone of light is present. Tympanic membrane is pinkish grayish, and landmarks are intact. Okay, I'm going to go ahead and do a whisper test. I'm going to have you plug your right ear, and then I'm going to whisper something, and then you repeat it back to me. Okay?
1, 2, 3. 1, 2, 3.
Good. Now I'm going to go ahead and do a Weber and Rhine test. So with the Weber test, I'm going to place this on the top of your head and let me know if you hear it with one ear or both ears, okay?
Both ears.
Good. And then with the Rhine test, I'm going to hit it again, and I'm going to place it on the bone, the back of your ear, where the bone is, and let me know when you stop hearing it. And then I'm going to lift it to your ear and let me know when you stop hearing it there too, okay?
Okay. It stopped.
Okay.
It stopped.
Okay. Good. And then the same thing over here.
It stopped.
Okay.
It stopped.
Okay. Good. So Weber and Rhine are within normal. And now I'm going to go ahead and look at your eyes. So take a look at me. Eyes are symmetrical. I'm going to go ahead and inspect right there. Okay. Conjunctiva is pink, sclera is white. All right, I'm going to have you, I'm going to have you cover one eye. Okay. And with that, I'm going to hold my hand up and let me know what number I'm holding up. Okay. I'm going to test your peripheral vision.
2.
Look at me, actually.
2. 2. 2.
And then cover the other one.
2. 2.
Look at this way. Sorry, look straight.
2. 2. 2.
Good. Now I'm going to have you follow my finger with, follow my finger with your eyes, okay? Good. No nystagmus noted, okay? Okay. First, before I do that, I'm going to have you read the last line you can read from 14 inches away from your face.
428365.
Okay. Visual acuity is 20/20. Good job. I am going to turn off the lights just to look at your cornea, okay?
Okay.
Okay. I'm going to have you just look straight, okay?
Okay.
Good. Okay. Good. All right. So red reflex noted, and optic disc is sharp. Okay, and I'm going to have you just look at me, and I'm going to look at your activity. Okay, from your eyes. So look right at my nose. Good. Good. So eyes are perla. Okay. Now I'm going to go ahead and look at your nose. Nose is symmetrical, no drainage noted. I'm going to test the patency, so I'm going to have you plug in one side and then breathe. Good, and then the other one. Good. Now close your eyes. I want you to tell me what you smell.
Alcohol.
Good. Cranial nerve is intact. Okay, I'm going to go ahead and take a peek inside too, okay?
Okay.
Good. So turbinates are pink and moist. Now I'm going to go ahead and look at your mouth. I'm going to go ahead and put these gloves on. You doing okay?
Yes.
Okay. Actually, before I do that, I'm going to palpate your sinuses too and let me know if you feel any tenderness, okay?
Okay. No tenderness. No tenderness.
Okay, good. Alright, so now let me grab this. Okay, so your lips are pink and moist. No lesions on those. I'm going to go ahead and look inside. Sorry. Good. Okay, I'm going to have you stick your tongue out. Good. So let me smile. I'm going to look at your gums. No bleeding noted. Teeth are intact. Gag reflex is intact as well. And your uvula is midline. Tonsils are +1 and they're not inflamed.
Okay.
So nice. Alright. So now I'm going to go ahead and assess your shoulders. Shoulders are symmetrical, clavicles are symmetrical as well. I'm gonna actually I'm gonna look at your necks first, sorry. Okay. Any pain or tenderness?
No.
Okay, I'm gonna feel you for your thyroid. Just go ahead and swallow. Other side. Good. Thyroid is within normal, no pain or tenderness noted, no masses noted. I'm gonna feel for your lymph nodes as well, okay?
Okay.
Your preauricular, postauricular, occipital, tonsillar, submandibular, submental, and supraclavicular. Any pain or tenderness?
No.
Okay, good. All right, so then now I'm going to go ahead and take a look at your shoulders. All right. Any pain or tenderness?
No.
Okay, good. I'm going to go ahead and feel your lymph nodes down here too, okay?
Okay.
Your pelvic, your cervical, axillary, lateral, and subclavicular. Any pain or tenderness?
No.
Okay, good. So I'm going to have you do some full range of motion exercises, okay? Go up, back, around. Good. Okay. Any pain while you're doing that?
No.
Good. So full range of motion of the shoulders. And I'm going to go ahead and palpate your epitrochlear node. Any pain while I do that?
No.
Good. Any pain?
No.
Okay, good. And then I'm going to have you extend, or flex, extend, go like this, supination, pronation. Any pain while you do that?
No.
Okay, good. So your elbows are in full range of motion as well. And I'm going to have you go like this. Push it against. Good. And then pull back. Good. So upper extremities strength is 5 out of 5. So now I'm going to go ahead and listen to the front of your chest and listen to your breathing. So the chest is symmetrical, AP diameter is within normal limits, no accessory muscles noted. All right. Okay, then go ahead and listen to the aortic, pulmonic, tricuspid. And then I'm going to also listen to the mitral for 1 minute. And this is also where the point of maximal impulse is, the left fifth intercostal space midclavicular. I'm going to go ahead and switch it to my bow. Okay. And back up. While I'm here, I'm also going to palpate your carotids, okay? And listen as well. Okay, so no bruising noted in the carotid. For the heart sounds, only S1 and S2 were heard. No murmurs.
Okay.
Okay, and now I'm going to listen to your breath sounds, okay?
Okay.
Good. Okay. Bronchiovesicular and vesicular heard throughout, no adventitious breath sounds, so that's good. Now I'm going to look at your back. Okay. So I'm going to place my hands on your back, and then when I do that, I want you to say 99, okay?
Okay. 99. 99. 99. 99.
Good. And then I'm going to go ahead and listen, and every time I move my bell, I want you to say E, okay?
Okay. E. 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 E.
Okay, good. So no adventitious breath sounds noted there. Okay?
Okay.
And then I'm going to just go ahead and have you take some deep breaths. I'm going to listen. Oh, I'm sorry. I'm going to go ahead and listen to your breath sounds now.
Okay.
Okay. So no tactile firmness noted when I was placing my hands like that, and no adventitious breath sounds when I was listening to your breath sounds.
Okay.
Okay. So good. And I'm going to have you lay down. I'm going to take a look at your abdomen.
Okay.
Okay. All right. Okay, so inspecting the abdomen right now. No pulsations noted. Skin is intact. No lesions. No abrasions. Okay. So now I'm going to go ahead and auscultate your bowel sounds. My bowel sounds present times 4. I'm going to go ahead now and listen to your arteries while you're there too. I'll name them out. Your aortic, iliac, renal, and femoral. no burning noted there, okay? Now I'm gonna go ahead and percuss. And I'm gonna percuss up here too as well. Okay, so it's dull where the liver is on the right upper quadrant. No timpani noted around the bowel sounds, and I'm gonna percuss over here too, where the spleen is. Okay, and no splenomegaly noted. I'm gonna go ahead and palpate. Okay, let me know if you feel any tenderness.
Okay.
Any tenderness?
No.
Okay, I'm gonna go a little bit deeper now. Okay.
Okay.
Okay, I'm also gonna palpate where your bladder is and let me know if there's any pain as well. Okay? Any pain?
No pain.
Okay, I'm gonna percuss as well. Okay, good. Now I am gonna have you sit up and I'm gonna test your costovertebral angle.
Okay.
And what I'm gonna do is I'm gonna have you let me know if you feel any tenderness, okay?
Okay. No tenderness. No tenderness.
Good. Okay, I'm gonna have you lay down now. Okay. Now I'm gonna look at your lower extremities. You can put this down. Thank you. I'm gonna look at your hips. Any pain or tenderness?
No.
Okay. Alright, so skin is intact. No ecchymosis noted. No lesions, no edema present, and no tenderness.
Okay.
Now, before I do that, I'm gonna do some leg exercises. I just want to see if you're having any pain in your right lower quadrant. Okay. So I'm gonna palpate here. Let me know after I relieve if you feel any tenderness.
Okay. No tenderness.
Okay. Good. Now I'm gonna have you try and lift up. Good. Any tenderness in your right lower quadrant?
No tenderness.
Okay. I'm gonna have you bend and cross. Any tenderness in the right lower quadrant?
No.
Good. Okay. While I'm doing that, I'm just gonna extend your hip. Any pain at the hip?
No.
Okay. I'm gonna do the same thing on this side, okay? Any tenderness at the hip?
No.
Okay, so full range of motion of the hips bilaterally. I'm gonna have you bend. See if there's any pain or swelling. Any pain or swelling?
No.
Okay. Alright, I'm gonna just extend out. Any pain while I do that?
No.
Okay. And then same thing with this one. Any pain or swelling?
No.
Okay. Good. So knees have full range of motion bilaterally, and I'm gonna have you bend this, and I'm just gonna look at your ligaments to see if there's any tear at all. Good. Any pain?
No.
All right, no laxity. I'm gonna do the same thing over here. Hold it. Any pain?
No.
All right, no laxity. Perfect. All right, now I'm gonna go ahead and take a look at your ankles, okay?
Okay.
All right, so no edema noted. Okay. All right, I'm gonna have you bend forward, up. Good. I'm gonna have you do it against my hand, and then go back. Against my hand, then go back. Good. Dorsiflexion and plantar flexion are both within normal, which is good. I'm gonna go ahead and palpate your pulses, okay?
Okay.
Dorsalis pedis, +2 bilateral. Tibial +2 bilateral. Popliteal +2 bilateral. And femoral +2 bilateral. Okay, I'm gonna have you come this way. Okay. I'm gonna have you push up off my hands. Good. Come back. Good. So lower extremity strength is 5 out of 5. So now I'm going to do some deep tendon reflexes.
Okay.
Okay. So first I'm going to start off with the biceps. Good. Triceps. Good. And brachioradialis. Good. And I'm going to do the same thing on this side. Brachial. And then this one. Good. Brachial radialis. Good. Now let's color. Good. Good. Oops, sorry. Good. Okay, so your deep tendon reflexes are intact. I'm also going to test for the Babinski, okay? Good. Good. So that was within normal as well. Okay. I am gonna test for your legs. I want you to close your eyes and tell me if you feel a sharp or dull side, okay?
Dull. Sharp. Dull. Sharp.
Okay, good. Excellent. All right. And then I want you to keep your eyes closed and open your hands. I want you to tell me if you feel a 2-point or 1 point, okay?
Okay. 2.
Okay.
1. 2. 1.
2-point differentiation is intact. So I want to test your fast hand movements.
Okay.
So I want you to go like this. Same thing on that side. And then your 2-point assessment with your nails. Yep. Heel to shin, heel to shin. All right, good. So now we're gonna go ahead. I'm gonna have you stand up. Okay, so I'm gonna have you turn to one there. Yep. I'm gonna have you bend down. I'm gonna assess your spine, no deformities. Okay, and we have stand up and do some flexion extension, lateral turns. Good. Good. And I'm gonna have hold your hips, and I'm gonna have you do lateral movements, and then bend forward and backwards. Okay. So the spine has full range of motion. Now I'm gonna have you walk, and I'm gonna have you go feet to toe. Okay. And then come back. Excellent. And now I'm going to have you have your hands out like this. Sorry. Close your eyes and stand there. Good. No sway noted. And then I'm going to have you open them up, and then I'm going to have you touch your feet like this, and then close your eyes as well. All right. Excellent. So negative Romberg test. And I'm going to go ahead. That concludes the end of our assessment.
Thank you.
Everything looks great. I'm going to go ahead and wash my hands again.
Thank you so much.
All right, no problem.